Thank you, Mr. Speaker. 5-year-old Brooke Aubuchon qualified for a clinical trial in New York to treat her rare genetic disease. This is the same disease that killed her brother Alex in 2011. Most of the medical costs are covered, but the travel expenses are not. Her family has brought their case to the health minister, written letters, and gone through every level of bureaucracy available. This family is running out of time. Minister, this government seems to be able to find money for outrageous expenses, bonuses to AHS, $1 million to the Olympics. Can someone in your government find some money to help this 5-year-old save her life?
Mr. Speaker, first of all, I have complete sympathy for the little girl that the honourable member is mentioning, or anyone who is suffering from a rare disease or an orphan disease. But as the honourable member knows, we have a process that is independent of government called the Out-of-Country Health Services Committee that includes an appeal process, Mr. Speaker, to determine eligibility for costs of healthcare services that are provided outside of Alberta. I haven't reviewed the particulars on this case. I am not the decision maker in this case, Mr. Speaker, but I'd encourage the honourable member to advise her constituent of the appropriate process.
For a supplemental, please, honourable member.
Thank you, Mr. Speaker. Given that Brooke's treatment is not covered by Alberta Health Insurance, she cannot be considered by the Committee for Exceptional Drug Treatment, and the Out-of-Country Medical Expense Committee has already refused assistance. Given that this family has followed every single step you have laid out in every single letter, she has written letters to the Minister of Health, the Deputy Minister, to Alberta Health Service. What else can this family possibly do to get your personal intervention into this situation? It needs your help, Minister.
Mr. Speaker, I believe I have a briefing on the decisions of the Out-of-Country Health Services Committee, and if they have been through the appeal process, the appeal panel information is available. But these decisions, Mr. Speaker, are independent of government. We do have a variety of programs within government to assist people of low income and families of low income, and I don't know if that is a consideration or not in this case, Mr. Speaker, but the process of determining eligibility for any health service, whether it's in our health insurance plan or not, is independent of the Minister.
Second supplemental, please.
Thank you, Mr. Speaker. This government is telling children and their families that have rare diseases and can't get any coverage that they're just out of luck. That's unacceptable. Minister, I understand there's a process. This family understands a process. They've followed the process. We've done the low income. We've done every single committee you've outlined. We've written to your ministry. I understand that this is not a political decision, but you're the Minister of Health. You have the ability to be kind and compassionate. You've done it before. Baby Alina, you have taken cases on personally. Brooke needs your help. She's 5 and she's going to die. The treatment.
Honourable Minister.
Mr. Speaker, this is hardly a place for an appeal to a minister or any other member of this government, Mr. Speaker, to go outside established processes that are evidence-based and independent of government to make what are very difficult decisions. It is further quite misleading and unfortunate, Mr. Speaker, that the honourable member on behalf of her caucus would claim credit for a political decision with respect to a very serious case that I had to review over the summer. That decision, Mr. Speaker, was made on the basis of clinical evidence that was available to us. I think Albertans expect.
The honourable member for Lethbridge East, followed by Calgary.